So RHA Health Services, we've been in Tennessee since 2001. We've been in North Carolina since the 80s. Can't tell you the exact year. The largest provider organization in North Carolina. We currently are in Kingsport, Knoxville, Chattanooga, Nashville, Murfreesboro, Springfield, Trenton, Jackson, Memphis, Rogersville being the newest location. So we provide services for people with intellectual and developmental disabilities, mental health issues. We do some substance abuse, not in Tennessee, but that is a North Carolina. We do lots of behavior services. So we are a multi-state, statewide provider agency.
Okay, and this space that we're in right now on Depot Street in Rogersville, is it open now?
It is open now.
Okay, when did this open?
So we just got licensed to open this office, but we assumed services for Chip Health Center on February 4th.
Okay.
So there was no gap in services for the individual supported. It was a seamless transition. They didn't know anything different. We hired their staff. We hired a lot of the clinical staff. So there were really no significant changes for them other than seeing some different administrative staff.
Okay. Were you guys staying in the same location, or were you at a different location?
The office?
Yeah.
So we operated out of our Kingsport office.
Oh, okay.
While we had to get this one licensed.
Okay.
We had a difficult time just obtaining an office space in Rogersville. There's not
Right.
a whole lot of offices around that were vacant. So once we got the office space leased, we did some painting and some cosmetic stuff in here. We had to get our IT set up, all of those things. Then we had licensure come in. So once the office was licensed, at that point we were able to open this office, and the clinical staff were able to work out of this office from that point on.
Okay. So how long have you been open? Right?
About a month.
Oh, okay.
Almost a month.
I guess you drive by and you see the old health store sign up there.
Right,
So
we've got our sign ordered. It just hasn't been up. We were hoping to have it before today, but it just has not been completed yet. So,
all right.
But we do have signage coming.
Well, what do you guys do here?
So here we provide services residentially. So we have 1 to 3 individuals living in a home where we staff 24 hours a day. And we also provide periodic services where somebody may still live at home with mom and dad, or they live in their own environment independently. And we provide staffing to meet the needs of that person.
Okay.
So it's very person-centered based on the location. We have how many supported living homes here? We have 9 supported living homes.
Okay.
And we support, I think, about 24 people out of Rogersville, all the ones who came from Chip Health, transitioned over to RHA, and we just continue providing the services they were currently getting.
Okay. And no, I don't know. That's all right. You're all right. You're going to be a star. You're going to be famous. Now, I don't know. I'm not an expert on Chip Health Center.
Okay.
Okay. But I do know that they had a lot of stuff that went on in their facility, a lot of programs and activities. Do you guys do the same thing here?
We do. So the Kingsport location under Amanda have monthly cookouts for the individuals. So I think they've had 2 so far that have been combined between the former Chip Health individuals and our existing RHA individuals. I think we've had over 80 in attendance at both so far between the 2. So we're combining the 2 units. It's been a really neat transition, seeing everybody start working together, the individuals getting to know each other and making new friends. So we do the same type of service that Chip Health did.
Okay, alrighty. So what would you like the community of Rogersville to know about RHA that they have? Because a lot of people probably haven't heard about you.
Well, we're open for business. We're excited to be in Rogersville. We're excited to expand our services. We are looking for employees. So if anybody's looking for a job,
what kind of work are you looking for?
So we're looking for direct care staff who work in the homes with the individuals. Sometimes it's one-on-one. It can be up to 1 to 3. They provide whatever that individual needs. So it could be very basic, taken to the grocery store, some budgeting type stuff. It can be full hands-on needs with all adaptive living skills. So it could be bathing, toileting, anywhere in between.
How many people do you need?
Amanda, how many staff do we need?
I'm sorry, what?
10 staff. We've got about 10 openings, and we're looking to grow. So if families have individuals who have support needs, we're happy to have them contact us, and we can either help them through the enrollment process through TennCare if they're not currently enrolled in services, or if they are currently enrolled in services, then we can assist with transitions to receiving RHA services.
And what's your service area that you cover for this?
So we
office?
cover, well, between the Kingsport, this is a satellite office of our Kingsport. So Kingsport's our main hub. We provide services in all the 9 surrounding counties up there, and then Hawkins County, and we're willing to expand into the next counties over if there is a need.
Right. If somebody is interested in acquiring your all services, what do they do?
They can contact the office. Well, we actually have a website. It's RHA Health Services.org, and they can go on there. That'll link them to Tennessee Services, and there's an intake form on there that they can complete, and it'll come out to the local offices who will then follow up.
Okay, all right. So they don't have to come here.
They can. They can come here. They can call. Amanda is split between Kingsport and this office, so they can contact this office or the Kingsport office, either one, and they'll be routed to Amanda.
And what are your hours here?
8:30 to 5.
8:30 to 5 weekdays. Okay.